Now it's time for tip-episodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
Welcome back, everyone, into this week's tip-episode. It's brought to you in partnership with Perio Protect. And as many of you know, Perio Protect has been a supporter of this podcast for so many years. But even more than that, they have supported the dental hygienist, the dental hygiene profession, in our role for disease eradication and prevention for going on 2 decades now, as they are celebrating their 20th anniversary this year. And it's an interesting thing to think about because for many of us, even though they've been around for 20 years, a lot of us still haven't really heard about them or had at least much experience with them, either in our offices or sometimes even like the whole entire town hasn't even heard of them. And it's my mission to get that changed. But today's tip episode isn't going to be about me gushing on and on about, how great they are, which they are. But I have a very specific message for you. And actually, it's interesting that one of the few charges that they asked me to do for this episode was that I be a little bit more provocative, which I think most of you know that I'm a pretty reserved kind of guy for the most part. And so it might be a little bit of a stretch, but I'll try and make this show at least a little bit intriguing. So let's start off with 2 huge statements. So number 1, I think that when a patient presents with a pocket of 5 millimeters or deeper, and then we tell them to brush, even if it's with a power brush, and floss as their home care, that statement is just as bad as a dentist putting a watch on a cavity. It is our fault at that point that they're not getting better, not the patient's fault. And then the second statement is that we have institutionally been misled that it's okay for patients with periodontal disease to sometimes have active disease. And I know there's a lot of psychology in that, and we think in our own heads, like, okay, well, we're going to see them, and if they have it every now and again, it's not that big of a deal, because that's what we do in our offices. We see them, 3 or 4 times a year, and we're gonna treat that problems. But that's a problem, and it's our problem. So let's tackle both those statements, and we're going to talk about how to shift ourselves and our patients into better health outcomes. So to start, let's talk about the reality of home care tools and what they can really do. In my mind, I think of home care tools strictly as preventive, similar to how we look at the whole perio versus prophy conversation, like right when we're coding it out, when we're actually delivering that type of care. I really feel like if a patient is healthy, then the brushing, the interdental brushes, the water flossing aids, all of the things that we tell them to do, all of those have a really great shot at keeping our patients healthy if they're already in a healthy state. But when they falter, when they start to go down the path of disease, whether it's gingivitis or periodontitis, the expectations that we now have for those same exact tools needs to be tossed out the window. Further, our expectations that just because the patient shows up to their appointment, we're going to go ahead and get at it with our instruments. We're going to send them home with a bottle of maybe prescription rinse, that they're going to be fine. Like that expectation is crazy talk. That's all we're going to do, and we're just going to expect that they're going to be healthy. We are at that point expecting the brushes and the rinses and all of that to get down way down deep and keep those pockets clean and disinfected for 3 months when we're not able to keep them healthy the prior 3 months before they presented. Like, we're just chasing our tails at that point. So like I said a minute ago, I want to shift it back maybe to like the caries management, the doctor putting a watch on it, right? So because there's so many correlations here. We always beat up on those doctors. Always. We're saying, hey, what are you going to put a watch on that for? And you're not going to do anything about it. You're just going to watch it until it gets bigger. Like that is kind of, it's a joke, but it's not a joke. It's what we always say. The doctors on their side are thinking, hey, we're being very conservative. We're going to tell the patient to brush and floss and use the rinse. As they were getting the decay, before they got decay, it's the same exact stuff. But go ahead, let's keep doing those things, and we're just going to go ahead and watch it. Then we as hygienists, we look at that and we're like, oh my gosh, you put your face in our palm, we're just shaking our heads. Like, it's so unacceptable. But then we turn around and do the same exact thing for our patients that have pocketing and disease, that are presenting with disease. We say, go home with these same tools and keep doing the same thing. And we're going to get better because maybe we scraped a little bit harder this time at your appointment, which we didn't, I guess, last time or something. I don't know what the thing is. Folks, this is all madness and it needs to stop. So we need to figure out this home care piece, which I'll talk about kind of towards the end of this. But then the second statement is, it's okay for patients to show up with a little bit of infected areas when they see us. And where I think that we're confused on this particular thing where, and to put into context, what I mean by this is, let's say there is a problem area. Our patient shows up and they have 3 5s in the whole entire mouth. I think a lot of times we're just like, that's okay. There's a little bit of bleeding, but it's of course it is, because they have 5 millimeter pockets, and we're just okay with this because we're conflating the whole once perio, always perio mantra. And then I guess probably maybe in addition to that, I think it's normal for many of us to think this way. It's not right, but I think it's normal that we look at disease on a scale or a gradient, right? So when we saw the patient for the first time and it was just a catastrophe in there, and then through all of the things that we did, they got mostly healthy in most areas. And so when they come back and they present, we're like, oh my gosh, this is so much better. Yeah, we're like, we are so great. Basically, the problem is fixed. There's a couple small little disease areas, but it's not nearly what it was when they got here. I think it's normal to think that way. But again, it's not okay, because normal does not make it the right thing. And so when we confuse all of these things, we then allow a 5 millimeter with bleeding to be okay. And it's just not. So with both of these issues, recommending tools that work only for prevention for the patient, not for the actual therapy, and then downplaying isolated areas of disease, we have on our hands a conundrum. And these two issues, they're going to prevent our patients from getting healthy, from at least getting completely healthy. We need to shift the conversations both in tone and approach. We could pull up the perio chart and the x-rays. We need to have conversations with our patients and say something like, hey, all right, Mr. Patient, let's look at these issues together. I've talked to you about so many different things, but I want us to focus on the factors that play into getting you healthy. And to do that, we need to look at the evidence. So for me, and I'm showing them all of these things, I then say, so what do you think that I am going to be looking at on this perio chart? And what am I looking for on these x-rays to determine if you're healthy or if you're not healthy? And at this point, when I'm doing it, and what I would encourage you all to do, is you just have to be patient. You have to wait for them to answer. If they're on the right track about, hey, pocketing and bleeding and all of that and bone loss on the x-rays, then all you have to do is confirm and continue. But if they're not on the right track, that means fundamentally, they have no clue what's going on in this whole entire appointment. And so at that point, we stop, we review good versus bad, and then we ask them again, what am I going to be looking at, until they get it right? And I know it sounds like we're talking down to them. We are absolutely not talking down to them. But there is a thing called informed consent. If our patients don't really understand what we're doing to them and why we're doing it, then they are not giving us their informed consent. So if we go through that step and we're all on the same page, at the next step, I always have them do their own diagnosis. I say, all right, Mr. Patient, so you know what I'm going to be looking for. Based on that, how do you think it looks for you today? Most of the time, they're going to be right on the money, right? If they know really what they're doing, they're understanding what I'm looking for, they're going to get this pretty much right. But sometimes they can be a little bit hard on themselves. I think part of it's performative, right? They want to do that for us. Oh my gosh, it's so bad. And they're expecting us to make it feel better. And for us, I think a lot of times we are, I don't know, it's going to take everything inside of us that's a carer, a nurturer, to not make them feel better and to not downplay the problem, right? They're going to come to you, and even if they only have like 4, areas of concern, oh my gosh, I'm a train wreck. And then you're going to be, no, it's not a train wreck. You only have a few areas. Like you can't do that. We got to stop doing that. Okay, so the next step is we've accurately assessed what we're looking for. They have accurately diagnosed the disease that we both knew was going to be the thing. You only need to lead them to probably maybe 2 more parts. And one is, okay, you have this disease. What therapy are we providing here at this appointment today and in subsequent appointments? What's the status for in-office care? And then what do they need to be doing at home? And we're going to skip to that part because the in-office stuff is important, but we already know that stuff. Because people have so many also different issues, they have some predispositions, whether it's going to be genetics, whether it's going to be ability to perform home care because of dexterity issues or what have you. Maybe it's a understanding, comprehension thing as well. You might need to take a little bit longer to discuss home care. We are always going to start with the common. So tell me what your home care routine looks like. you can't, again, we talked about, open-ended questions and things like that before. You can't say, are you brushing and flossing? They say yes. How many times you're brushing and flossing? They know what they're supposed to be saying. How long do you brush for? They know they're going to say 2 minutes, but we don't really know if that's really true. So tell me about your home care routine. Tell me about your home care process. The things that they're doing right, you're going to confirm and support. And then you're going to bring up that perio chart one more time. They are presenting for disease. That's why you're having this conversation with them. For the healthy patients, you wouldn't have the same type of conversation. So you bring up the perio chart again. You let them know that the things that they have been doing, there aren't bad things. The things that they need to keep doing also have led to this result, this perio chart, this set of radiographs, this bone loss. And if they're a long-time patient, you can even show them previous charts and say, hey, this is a chronic problem. And then you ask them, so what can we do differently to get a different result? What are we going to do to finally get your mouth healthy? And then again, just stay quiet. Let that silence do all of the talking. Listeners, here's the thing. For me and for my practices, there's only going to be one answer to this. There's only one more thing for me, in my opinion, that they can do to get healthy and stay healthy. And I say this because we have had hundreds of patients come back with the same reliable outcomes, the same reliable results. And the answer is Perio Protect trays. I want something that is easy to use. I want something that's comfortable for the patient. I want something that they're not going to have to really think too much about or be too technique sensitive. I want something that's going to deliver a safe gel below the gum lines to kill the bad bacteria and give life-sustaining oxygen to the good bacteria. And I want to work with people who will help me solve the patient management issues I might run into, to help me solve problems that I cannot do by myself. The Perio Protect team is really great. And they can have these and similar conversations with you to help get your patients past the finish line, especially those patients that keep kicking treatment down the line. Those ones that are just a little bit stubborn, that we're just maybe not equipped to know how to handle them. Well, guess what? They have talked to hundreds of clinicians, thousands of clinicians. They have seen every case. They'll be able to help you with this. So if you want to give your patient a real opportunity to finally resolve that bleeding and that pocketing, to enjoy the whiter teeth and the fresher breath, to get over the hurdles that institutionally they've had to overcome, then you need to be educated on this yourself. In 15 minutes a day, your patients can beat a problem that no amount of brushing or flossing or really any manual manipulation could ever beat. So to answer the title of this episode, of if periodontal disease is really a patient's fault or not, it kind of doesn't matter, right? It doesn't matter that although historically we have loved to place blame on our patients for not being healthy, although historically we have told them to do things that maybe weren't the best tools or options for them at that time, we need to change that mentality and just get them those right tools for the job. And so if you're ready to jump in with both feet, maybe you just want to casually learn a little bit more about some of the things I've been talking about, head over to perioprotect.com/RDH. There's a ton of information over there. Their website has a bunch of information. Another great tool is read the Google reviews. Read what the patients are saying about the Perio Protect so that you know what your patients are going to expect when they get it. Thank you all for listening. I really appreciate you being here. Thank you to Perio Protect for supporting this episode, supporting our profession, delivering on patient care excellence, all of the things. Congratulations on 20 wonderful years. Enjoy the weekend, everybody. Thanks.
A tale of two hygienists.